We at Shared Action are funded by the Centers for Disease Control and Prevention to provide free trainings and one-on-one technical assistance for health departments and CBOs on evidence-based interventions and public health strategies, monitoring and evaluation, organizational infrastructure and program sustainability, and alignment with NHAS and HIHP in HIV and AIDS services. We at Shared Action would like to acknowledge AIDS Project Los Angeles, the Centers for HIV Identification, Prevention, and Treatment Services at UCLA, and the Centers for Disease Control and Prevention for making this webinar possible. Our presenter today is Rob Lester. Rob, after graduating from UCLA in 2012, has served as a public policy analysis for both Shared Action, AIDS Project Los Angeles, and UCLA, as well as other organizations in the field of HIV and AIDS. And without further ado, here's Rob.
Thank you so much, Patrick, for that wonderful introduction. And thank you, everybody, for joining us today. As always, it's a pleasure to speak with you about the lovely Affordable Care Act. So today in the presentation, we'll start off with a few definitions about some terms that will be necessary for the conversation going forward. I'll spend just a few minutes reviewing some of the important aspects of the ACA that are pertinent to the conversation today. We'll hit on some information that you guys are going to need to prepare for the client transition, to prepare for the transition to the Affordable Care Act and what you can do to help your clients prepare. Then get into a little more detail about preparing your agency for the Affordable Care Act and preparing your clients for the Affordable Care Act. And then we'll wrap it up with a review and have some time for some questions. So some definitions. So first of all, QHPs are Qualified Health Plan. It's a plan offered by an insurer through a state health insurance exchange or marketplace. And ECP are an essential community provider. It's a healthcare provider that serves high-risk, special needs, and underserved individuals. That includes Ryan White providers. So basically, the ECP are you guys, and the QHP are the insurance companies that are selling insurance through the new health insurance exchanges. So right now, the status quo in most states is the care of persons who are living with HIV/AIDS, or the care for people who are HIV positive. Most of that's covered through Ryan White, or a chunk of that's covered through Ryan White and Medicaid. Ryan White includes obviously ADAP, premium support, and a variety of other services. And we all know that other services includes a lot of pieces that are really important for helping people who are HIV positive stay in care. Eligibility varies considerably from state to state. Certain states have much lower eligibility requirements, while other states are more generous in their eligibility. And it's important to bear in mind that Ryan White, although it does tremendously good work in helping people who are HIV positive pay for medication, it's not health insurance. So as we all know, if you're on Ryan White and you have a car accident or you have some sort of other medical condition like cancer and you wind up in the hospital, Ryan White's not going to pay for that. So as wonderful as the Ryan White program is for people who are HIV positive, there's still a tremendous unmet need among otherwise uninsured persons for other sorts of health, for actual health insurance. So the ACA envisions helping people get insurance in a couple different ways. First, there's the expansion of Medicaid. Now, as we all know, under the Supreme Court's ruling on the Affordable Care Act, this is not going to be, not all states are not required, rather, to implement the Medicaid expansion. So some states are and some states aren't. Generally speaking, the states on the coast are and the states in the middle of the country are not. So for states that are implementing the Medicaid expansion, individuals whose income is less than 138% of the federal poverty level, or about $15,000 a year for a single person, will be eligible for Medicaid. Now, Ryan White will, for people who live in states that are not implementing the Medicaid expansion and whose income is less than 100% of the federal poverty level, they'll continue to receive Ryan White care. Ryan White will also remain in place for people who are undocumented, for people who are otherwise exempted from the ACA, and for services that are not otherwise covered by insurance or Medicaid. So this includes things like benefits counseling, housing services like you might have through HAPWA, food assistance, Anything that is not otherwise covered by insurance, Ryan White will continue to be able to provide. The Qualified Health Plan, or QHP, enrollment starts October 1st, and coverage will be effective January 1st if you are enrolled by December 15th. There will be subsidies available for people whose income is between 138% and 400% of the federal poverty level in states with Medicaid expansion. And those subsidies are available for a slightly expanded range in states without the Medicaid expansion. It goes down to 100%. Obviously, people who are whose income is less than 100% of the federal poverty level and who live in a state without the Medicaid expansion, although they will continue to be able to receive Ryan White if they are HIV positive, they will not have access to insurance in addition, other than what would already be available today. So if they already have some sort of categorical access to Medicaid right now, they will continue to have that. But if they don't currently have access to Medicaid under the current law, and their income is less than 100% of the federal poverty level, and you live in a state that's not implementing the Medicaid expansion, you will continue to be as you are, which is uninsured. Obviously, there's a tremendous amount of diversity in how the Affordable Care Act is being implemented, and a lot of it depends on the decisions that state agencies and state leaders are making. Given this, it's important that agencies are proactive in seeking out information on how the decisions your particular state is making. So some of the questions that are important to be asking is, who's operating the exchange in your state? Some states are operating their own exchange, like California. Some states are operating a joint exchange, so their states are working with the federal government to operate that, like Arkansas. And some states are preferring to let the federal government run it themselves, like, for example, Texas. Which decision your state leadership has made with regards to running that the insurance exchange will have some impact on both how the exchange is run and at least who you need to talk to, so who the leadership is. So this information is fairly easy to find out, but it varies from state to state. So you guys need to find out who's operating the exchange in your state. Obviously, it's really important to know if your state's participating in the Medicaid expansion. And what are some plans? What are the plans that your state leadership has made with regards to Ryan White post-implementation? It's also helpful to find out, what other ECPs and providers in your state are doing. So presumably there are other organizations that are similarly situated. What decisions are they making? The FQHCs, what plans are they making? This is an excellent time, if you haven't already done so, to reach out and network with these people and just have a conversation about what their plans are, what their concerns are, so you guys can begin to work together to make plans so that the needs of clients are well served moving forward. For those of you who work closely with particular providers in your community, this would be a good time to talk to them and maybe see what their concerns are and see if you guys can help each other figure out and plan for the future implementation. In addition to reaching out to state leaders and to other CBOs or other people in your community, it's also important to assess how familiar your staff is with the Affordable Care Act. How familiar are they with the regulations? How familiar are you guys with the plans of your state? Does your agency have written plans for how to deal with the implementation? There's a lot of information on the there's a lot of moving pieces of the Affordable Care Act. And I know for myself, even when there are times when I think I have some obscure piece of it nailed down, and then I will go back and read some other analysis, I'm like, oh, that's something I had not anticipated. So I find it really helpful to have a written plan for how to deal with the particular pieces of it. Also, if you guys bring on board new staff, obviously it facilitates the educational process if you have written documents to which you can refer. And finally, it's important to assess your client's knowledge. I'll talk about this a little more later on, but there's a tremendous amount of diversity among clientele about how well informed they are about the basics of health insurance and governmental programs. And so at some point there needs to be a process of assessing clients and determining what their particular needs are. So in terms of prepping your agency for the implementation of the Affordable Care Act, this is really the heart of what this particular I guess, one of the two hearts of what this particular webinar is going to be about. So one of the goals of the Affordable Care Act obviously is to expand the number of, or increase the number of people who have access to insurance or have insurance coverage. So many people who currently receive, whose HIV-related care is currently paid through Ryan White, will have access to either Medicaid or to private health insurance through a QHP. As medical providers, whether or not you guys are a medical provider or just a community-based organization that provides service to people who are HIV positive, it is important that you take the time to become a qualified provider under your state Medicaid plan or managed care plan. It's also important to do the same thing with the QHPs. HRSA regulations require that QHPs contract with 10 to 20% of ECPs depending on the particular circumstances of the locality. So ECPs, so the QHPs, the health plans, let's go with that, actually have an incentive to establish contracts with community providers. So it would be useful to call the QHPs, the health plans, and say, okay, I'm an ECP. I can help you meet that 20% requirement. Why don't we establish a contract so that you guys can get credit for having us as a contractor? It is important also, it serves your interest to do this because you will at some point begin to have to compete for your clients. When clients gain insurance, they're no longer required to receive care through a Ryan White provider. So if you are a medical provider and you don't have a contract with a QHP, the clients are not going to be able to receive care from you. And so you back up. So okay, sorry, I got a little confused there for a second. So as clients gain insurance, they're going to have more options to seek services. Basically, agencies will have to compete to retain their business in some cases. You guys have an advantage in that you have existing relationships with your clients. You have cultural competency, you understand their needs, and you have, in many cases, been working with them for years. Again, you need to make sure that you have contracts with the QHPs and the Medicaids so that you can bill for the services that you provide for the clients. Again, this includes both the QHPs and the Medicaid or Medicaid managed care. As I mentioned before, you need to identify the qualified health plans in your state. Your state insurance department or state insurance agency should be able to help you do that, or the information should be available online. And because HRSA requires QHPs to contract with a certain percentage of ECPs, usually 20% or 10% depending on the particular circumstances, QHPs have an incentive to establish contracts with you guys, and it also helps you guys meet the needs of your clients because you'll be able to provide them services. In some cases, the process may require technical upgrades to your billing system. If so, it's especially important that you get out in front of this. It may not require it. It may. There may be costs, and it may be. You guys may need to do sort of a cost-benefit analysis to see that if it's in your best interest to invest money in doing this. But in either case, no matter what decision you make down the line, you need to go ahead and start the process of talking to the QHPs and seeing if you can establish a contract and what the requirements are. Now, you may be thinking that if you're not a medical provider, really, what's the point of having a contract with an insurance agency? But it's important to remember that some of the non-medical services that are currently covered under Ryan White may be covered under new health plans. So if you have a client that has a plan that covers service, Ryan White will not pay for that service because Ryan White is and will remain a payer of last resort. And you guys have something really unique to offer your clients. You have tremendous depth of knowledge with HIV/AIDS. You have tremendous cultural competency, and you have an established relationship with these. And not only is it in your agency's best interest, but it's also in your client's best interest if they can continue to receive culturally competent, expert services from your agency. And it will not be in your client's best interest if they have to go seek that from an unfamiliar provider because you guys don't have a contract with a QHP or with your state Medicaid agency. Now, as I mentioned before, Ryan White will continue to provide care for many people. It'll continue to cover people whose income is less than 100% of the federal poverty level in states without the Medicaid expansion. Again, 100%. That's about $12,000 a year. Coverage may still be too expensive for some. You need to check with your state Ryan White program about premium subsidies. HRSA is a little unclear about this, but there may be a possibility for you to subsidize premiums for clients who are in need of that. There is currently no mechanism set up yet to directly subsidize costs through the federal exchanges, but it is possible that states will have direct mechanisms set up. In cases where there's not a direct mechanism set up, it may be a matter of you guys actually mailing a check, either giving a check to the client or working some sort of arrangement out. You guys really need to speak with your state program managers about how you want to handle that particular piece of the finances. Also, undocumented and recent immigrants will continue to need White services. New citizens who have been in the United States less than 5 years are not permitted to participate in Medicaid, although they are eligible for certain subsidies. So Ryan White may be important for those people. Finally, there will also be individuals who will opt out of the exchanges for various reasons. There will be people with religious objections, or people who are exempted because even with the subsidies, coverage will remain too expensive. And even those who obtain coverage will still face substantial out-of-cost expenses in some cases. Ryan White providers will play a large role in ensuring that particularly vulnerable populations, people who are HIV positive, do not drop out of care because of changing cost structures. Also be aware that Ryan White provides a much broader suite of services than either health insurance, or the QHPs rather, or Medicaid. This is one of the strongest advantages that your agencies have in competing with other providers. In California, we've seen that people who are HIV positive who transition to other forms of coverage often continue to receive non-medical services from Ryan White, in particular benefits counseling, again, housing assistance, food assistance. Those are things that, as you know, health insurance just doesn't cover, but can play a vital role in ensuring that people who are HIV positive remain in care and get the maximum benefit possible out of the antiretrovirals that they're taking. So preparing your clients for the Affordable Care Act. Now, the clients are going to go into this transition process, as you guys well know. The clients are going to go into this transition process with a wide range of skills and diversity of knowledge. For some, they'll be really well versed in the intricacies of government programs and will understand health insurance very well. For others, however, they may never have had health insurance, and they may be poorly equipped to advocate on their own behalf should the transition process encounter difficulties. Therefore, you should be prepared to assess the client's ability to provide such assistance as needed. Obviously, say for example, a 55-year-old gay man who's been, or a 55-year-old man who's been on disability since 1995 and worked in a corporate job before then is in a much better position to advocate on his own behalf and to understand what is required as a insured person than somebody who, than say a 25-year-old who has never had private health insurance. Some particular issues that may come up for some of your clients, again, just basically how does health insurance work? Premiums and cost sharing. So, for example, the difference between what a premium is, what a copay is, what a deductible is, out-of-pocket maximums. These are things that are important in assessing and determining which plan best meets the particular client's needs. Also, clients need to understand formularies and provider networks. Although the Affordable Care Act requires that health insurance plans provide pharmacy services or provide prescription drug services, it doesn't really address, it doesn't go into detail about what sorts of pharmacy services are required. So it may be that they're required to offer one prescription drug within each drug class, but that doesn't mean that it's going to cover the particular prescription that a client is on right now. So clients need to understand how to assess which health insurance plan best meets their needs. Also, they need to understand about private provider networks. If you live, many people, not just HIV positive people, many of us have established relationships with our doctors, and we don't like switching. And people who are HIV positive experience enough challenges already accessing care without being told, okay, well, you picked this plan over here, so you're going to have to go find a new provider and go through the whole process of letting that provider get to know you and establishing a working relationship with him. So it's important that clients understand that even though a particular plan may have a lower premium or lower deductible, that the formulary, it may be able to offer that lower premium or lower deductible because it has a more restrictive formulary or a more restrictive provider network, and that may not serve the client's best needs in the long term. So again, all this goes into helping clients understand what criteria they need to use in choosing the best plan. They may need help understanding how to balance financial and service factors to choose which plan works best for their particular circumstances. Some clients will probably need assistance filling out paperwork or the application. Some clients may, there may be a need for to assess the client's life skills to make sure they're sufficiently developed and stable, that the client has a stable, has the ability to sort of work through the paperwork part of it. Does the client have a mailing address? How are they going to handle correspondence with the insurance provider and Medicaid? A lot of you guys have already worked through this process with many of your clients, but it is something you need to needs to be borne in mind as clients are working through this process. Finally, some states offer a choice of Medicaid managed care plans. Again, just as with choosing the best health insurance plan, clients rather need to take into consideration the various formularies and provider networks and picking which plan works best for their particular life circumstances. I'm going to do this a little faster than I anticipated. Summary. So hitting on the summary. So less than 4 months until enrollment starts. We've been hearing about this for, if you work in health policy, as we all do, or health care as we all do, we've been hearing about this endlessly for years now. But enrollment starts October 1st of this year, so that's less than 4 months away. And people will begin receiving health care for the new health care plans or through the new Medicaid plans in January of this year, so that's just a little less than 7 months. If your agencies have not already established relationships, if you guys have not already established relationships with your state agencies that will be over pursuing this, this would be an excellent time to do some networking. Although this is a federal program in many ways, it is being implemented on a state level, and it is important to have some level of relationship with your state agencies if you don't already have that. There will be questions about how things are implemented, and it's really helpful to know somebody on the state level that you can call and say, hey, I have this question about this thing, can you guys help us with it? It's important, given the diversity among the states, it's important to have a good sense of how the program will be implemented in your particular state. Again, your agencies need to prepare for working with new payers. Staff will need to be trained. And finally, again, this is really important, it is important to educate your clients on what they will need to do in order to ensure that they get the most they can out of the newly available newly available plans or the newly available Medicaid. So finally, the last two, there's some additional resources I've included here. I'm sure some of you guys already know about this, but it's difficult in the context of a webinar to go through a lot of this technical information. I would really encourage you to look through some of these, in particular on the second page here, that first source, the summary of the Affordable Care Act. If you're a little unsure about how the bill is structured or how it's going to work, how the Affordable Care Act, this is about a 3 or 4 page summary. It's a little dense, but it's much easier than reading the original bill. So this can help you understand sort of how the basic thing is going to work. That last source there is implications for American business. So if you're concerned about if you have clients who are employees and they receive their health care through their employer, or if you're interested for your own benefit, that provides some information on how the Affordable Care Act looks from the perspective of employees. And finally, again, the resources on that first page, I'll switch back to that, those are provide just a broader overview of the Affordable Care Act and some issues that come up from time to time. So that leaves us a bit of time for questions. So,
thank you, Rob, for a great presentation. We have a couple of questions already. And if you have any questions now, please go ahead and ask them through the chat feature or the questions feature on the webinar to the right side. One of our first questions asked is, will people on Ryan White be required to enroll into coverage through the healthcare exchange in their state if they qualify for it?
That is a great question. HRSA is strongly urging Ryan White providers to do everything within their power to assist current clients in enrolling in whatever programs are available. HRSA has not yet issued guidance on what will happen to people who refuse to do the paperwork. My understanding is that that guidance is forthcoming. That's the official line from HRSA. If you put me in a corner and poke me with a stick and make me guess, I would say that we're going to give people, that HRSA will give people 6 months or maybe a year to enroll, but eventually it'll come down to either you enroll or you don't get services. But that's not where we're at right now. HRSA has not issued any formal guidance yet, but they say the guidance will be forthcoming at some point.
And what resources are available more on the state side of things? So if I wanted to go and find more information about Arkansas and how it will be affected by the ACA, where would I start to look?
I would start with just some of the websites we listed here. The Kaiser Family Foundation has a fair amount of information on the ACA, sort of a broad overview, and you can search for a particular state on their website and get some information. I would start also with your state insurance department or insurance agency or whoever oversees insurance within your state. Start talking to them, and they should have some idea of how this is going to work. And one thing you can do is you can do a search in Google. If you go to Google and type in, say, Arkansas, and then you type in, I'm going to do it letter by letter here, site::.org. That'll restrict your search output to things from a .org, which is usually a nonprofit organization. That's a pretty good way of narrowing down your search results to more thoughtful analysis. It doesn't guarantee that everything you read is going to be correct, but that's one way of narrowing down your search results so that you get a better set of results.
I'm typing that into the chat box right now just so you have a better reference for what to type in. Yeah. We have a couple of questions asking for the PowerPoint slides. Typically, we'll upload them on our website 1 or 2 days afterwards. But given we have the resources that Rob has included on this presentation, I'll send these out immediately after to everyone that's attended the webinar. And they'll still be available on our website in a couple of days. We have another question just asked, and that is, can Ryan White funds be used to supplement the services the insurance doesn't cover, or services that a client already has met a limit for?
Absolutely. Well, I say absolutely. There are 50 states in the District of Columbia, and every jurisdiction has its own unique rules in implementing Ryan White. So there may be particular quirks that your jurisdiction may have a unique perspective on how to interpret guidance from HRSA. Given that, yes, going forward, this will be one of the largest roles for Ryan White, is providing the sorts of what we call wraparound services that are not covered under health insurance or Medicaid. Here in California, I participated in a survey of Ryan White providers, and about 40% of the clients of the agencies that we sampled who went on to Medi-Cal, which is our state version of Medicaid, who went on to a managed care program, continue to receive some sort of services through Ryan White. Oftentimes this is housing assistance, food assistance, continued benefits counseling. As you know, in some cases, Medicaid offers in some states, Medicaid offers a fairly restrictive set of services to the clients. And even for the private health plans, in some cases, the deductibles can be really challenging to meet for clients who are particularly low income or whose income sort of is a little too high to get the most generous subsidies, but too low to really be able to afford that. And I think Ryan White will, at least in the short term and probably in the long term, will continue to play a really important role in ensuring that people have access to those. I don't understand that.
Okay. Another question asked is, can the presenters talk about best practices or models for patient navigators?
So patient navigators. Okay, so that phrase gets tossed around a lot. Unfortunately, when they wrote the Affordable Care Act, they took a term that was already in use and appropriated it for something else. So if by that you mean people who help patients work through the general medical system, which I kind of don't think that's what you mean. I don't really have anything to say about that. If you're talking about the part of the Affordable Care Act where it's patient navigators to specifically help people enroll in the new insurance, HRSA provided grants for that. The window for submitting your grant applications to become a patient navigator ends Saturday. So if you have already put your application in, it's probably a little late in the game to be trying to jump on that. As far as just helping your clients choose the best insurance plan, going back to what I mentioned earlier, I think a lot of that goes back to ensuring the clients understand the basics of health insurance. You know, again, the difference between a copay, a deductible, out-of-pocket maximums, all that, and ensuring that they have the knowledge necessary to evaluate the various insurance plans that are offered and pick the one that is, and help them be able to choose the one that is best for them, especially given that they may have to choose between a slightly higher monthly premium and a more generous set of services, and that can be a challenging choice to make.
I definitely agree with that, and I think that patient navigation it's a giant topic.
Yes.
There's a lot of ambiguity around it, there's a lot of confusion around it, and this may be something we even consider hosting a separate webinar about in the future. So please, if that's something that interests you, let us know in the webinar evaluation feedback, and we'll try and host something around that. We've also recently identified a couple of great resources around patient navigation that we'll try and share with you that might help shed a little bit of light on this as well. The next question is, what should a Ryan White consumer consider when choosing a health insurance plan that provides care equivalent to Ryan White funded medical care?
I think the most important things to consider are the, first of all, there's obviously the client needs to consider the premium they're going to pay, how the out-of-pocket maximum, deductible, and copay are structured. For some people, having a $1,000 deductible that's due in January of every year is going to be, that's not going to be feasible. I mean, that just will not work for them. But they would be able to pay, say, so that they're more comfortable with like a lower deductible but higher copay throughout the year. Other people can pay that $1,000 at the beginning of the year, and save the money later on and lower copays. So the client needs to be familiar with his or her own particular financial circumstances and how the cost-sharing features are structured, how that best works with their own financial need. They also need to take into consideration, obviously, the formulary. There will be, the Affordable Care Act requires that health insurance plans provide what are called essential health benefits. And those essential health benefits, however, are defined differently for each particular state. And even within states, different plans will offer different sets of services, include different sets of formularies. So clients, so if you're on a particular medical or a particular pharmaceutical regime, given how important that is to the effective treatment of HIV, clients need to make sure that whatever meds they're on right now, they will continue to be able to receive if they choose a particular plan. And finally, again, provider networks. Having a doctor that a client is comfortable going to see is such an important part of receiving good medical care. Having a physician whose office is close to you is important to receiving medical care. So I would say the most important things that you need to take into consideration are the financial aspects of it, the formulary, and the provider network.
And also, I mean, this is one of the things that the patient navigators, as in the people who will be helping everyone who is currently uninsured find the new insurance, will be helping them out with. But in addition, this is something that you would want to consider educating yourself more on, because this is a question you're going to often start getting asked by your clients as the ACA grows near is, what do I choose? A lot of your clients are going to start asking that question, and on one hand, you can just say, well, look forward to the services that are going to be provided, and there will be people out there to help you once this is implemented. But if you can educate yourself now just on the general insurance policies and generally what you'd want to recommend to your clients, because you technically, you are one of the people that know your clients the best because you've been serving that population for however long you have. It would help to be able to educate yourself on this general sort of insurance spectrum, so you may be able to advise your clients before ACA actually hits and help alleviate some of the strain on the system.
One more thing. If I remember correctly from HRSA regulations, patient navigators are not allowed to explicitly recommend a client sign up for a particular health insurance plan.
Correct.
You guys do not operate under that constraint. So there may be an opportunity for you to provide your clients with more prescriptive information than a patient navigator will be able to do. If you know that 60% of your client population is fairly similar in their demographic circumstances, it might benefit them if you, as the Ryan White provider, were able to offer them maybe a more limited set of options than they would see if they were to go online and look at the health insurance exchange. There are going to be some options available that are really just not going to work for people who are HIV positive. And to help, if you could help narrow down for the clients the available options, it will do a lot of the legwork for them and help them be better positioned to figure out what is best for them. Oftentimes we think that more choice is better, but sometimes being confronted with too much choice causes people to have difficulty figuring out which option is best for them because it's too much computations to do. I know sometimes I go to a restaurant and there's 300 things on the menu and it's like, well, I have no idea what I want. Who knows? So I just pick something. Whereas if you go to a restaurant and there's like 6 things on the menu, you're like, oh, well, that's a manageable analytical problem. So you just pick what's best. It's the same thing. If your clients are facing too many options, it will actually impede their ability to choose what is best for them. So if you can help them get to the point where there's a limited set of options, they can say, oh, it's either A, B, or C. That's a much more manageable problem for people than choosing among 15 or 20 different options.
And we really don't want to be reactive with this sort of information. You don't want to be put in a situation when you have a client come in with the incorrect insurance, with the insurance that really doesn't work for his or her HIV status. And then you have to deal with getting his or her insurance, and that can be a long and tedious process. So the more of the legwork you do now on researching the ACA, researching the general insurance plans that are going to start to be covered under this, you're going to save yourself a lot of time and your clients a lot of grief in the future. Our next question is, what do you know about the penalties that those who do not enroll have to pay?
Let's see, for the first year, I think the penalty is $95 or 1% of your annual income. A lot of times when you read analysis, say, on the internet, people will say, oh, well, it's only a $95 penalty, so people are not going to sign up. But it's the greater of the $95 penalty or I think it's 1% of your income. And to 2015, it goes up to like, I think 1.5 or 2% of your income. And in 2016, it goes up to, I think, 2.5% of your income. Sorry, I don't have these figures actually in front of me. And every year, there is a dollar limit and a percentage of your annual income limit, and it is the greater of the two. For most people who make more than $15,000 a year, it's going to be the percentage of their annual income that will be the greater. And if they don't have that, that will be the penalty that will apply. Now, that penalty will be enforced through the IRS. The IRS cannot, normally if you don't pay your taxes, the IRS can come take your stuff, basically. In this case, they can't do that. All they can do is deduct the amount you owe from any tax refund you would get the following year. That being said, for people who are HIV positive, it is difficult for me to construct in my head a circumstance in which they would not be better off financially to take the program, to take the plans that are available with the subsidies and any other assistance than they would be to pay the penalty. So for your clients, I would strongly, strongly encourage them to sign up, and I would encourage you to encourage them to sign up. And again, as I said before, although HRSA has not yet issued regulatory guidance on this, we anticipate that in the future they will do so for how to deal with people who refuse to sign up. And I expect that at some point people who refuse to sign up will no longer be allowed to enjoy the benefits of the Ryan White program, although they have not said that yet.
Okay, and we have our last question for the webinar. Will insurance tax credits be paid as premiums paid directly to insurance companies?
Yes.
Simple answer?
Yes. The back end of it's kind of complex for how it all works out, but yeah, the feds are not going to send checks to clients and have the clients send the checks off to the insurance companies. Again, it's complex. Yeah, basically, once you sign up, the Treasury Department will apply a credit to the insurance company's account. So.
Okay. Well, I'd just like to thank Rob for being here today and sharing all this great information with you.
Thank you guys for having me.
And to close the webinar, I'd just like to inform you that our website, sharedaction.org, we have plenty of technical bulletins, broadsheets, and past recorded webinars on a lot of the relevant information as well as the information listed on the screen. We did have a previous webinar hosted by Rob, generally covering ACA that you can find on our website through the program toolkit, as well as other ACA and NHAS related webinars. I ask and I encourage you to please fill out the post-webinar survey. This is where we find out what webinars you'd like to see from us in the future, how well we're doing, so we can try and continuously improve and provide you the best information possible through these webinars. If you would like any assistance, any technical assistance or trainings, please email myself at pstanley@apla.org or visit our website, sharedaction.org or sharedactionhd.org. And I'd just like to announce that in, I believe, 2 weeks, on the 20th, we'll be hosting an online workshop on survey design to help improve your ability to create survey questions, design an overall survey, and just improve the results that you're getting from surveys. So look forward to that on the 20th, and we'll be sending out an advertisement for that in the near future. Thanks everyone for attending. Have a wonderful day. And this is Dr. Stanley, and thank you very much.